Hello everyone and welcome to our next topic on this online course, the history of vaccination and the disease burden. Let us start with the history. This timeline is information heavy, but shows the important landmarks in the history of vaccination. As we can see, the concept of vaccination has already started even before the first ever vaccine has been created. Back in the 15th century, the practice of variolation has already started in China, where they create a powdered smallpox material from scabs of these deceased people and make a healthy person inhale these to protect them from the disease itself. It took more than 200 years for the first ever vaccination for smallpox to start with Edward Jenner in 1796. From there, vaccines for several other infectious diseases have been discovered. During this time, the scientists noticed that countries that had vaccination programs showed less mortality and morbidity to certain diseases compared to the ones without programs, and this led to the launch of the Extended Program of Immunization, or EPI, by the World Health Organization in 1974. In 1998, a journal from The Lancet was published correlating autism with MMR vaccination by Andrew Wakefield, which caused an uproar worldwide and a decrease in vaccine confidence. Even though this paper has been retracted and the author's medical license revoked, this had a huge impact on the vaccination, which can be seen until today. Despite the issues, new vaccines are still being produced to prevent more diseases worldwide, and there are even more in the pipeline to improve on the currently available ones and to cover the neglected ones. Here we show the top cause of death in the world. These graphs are according to the World Health Organization data of 2016. As we can see, both communicable and non-communicable diseases are in the list. Worldwide, ischemic heart disease is still the number one cause of mortality, but as we look at the low-income countries, infectious diseases start to increase in the ranking. The next part of the presentation, we will go through two different infectious diseases and their burden, one that has already been eliminated and one that is still continues to affect several thousands of lives worldwide. We start with smallpox. During the 18th century, there was a high morbidity and mortality due to smallpox, but with the advent of Jenner's vaccination, we can see from the graph a huge decrease in the numbers. During this time, not all countries were vaccinating for smallpox, and they noticed that countries that adopted vaccination had less cases and fatalities compared to the ones that did not vaccinate. This was occurring alongside public health improvement. As you can see from the two figures below, countries that have adopted vaccination early have successfully eliminated the disease, as seen in the white and green countries, and still found in several other countries during the 1950s. By 1977, the last case of smallpox was detected in Somalia. The history of smallpox shows that it is possible to eradicate a disease. With no new cases detected worldwide for 3 years, smallpox was deemed eradicated by 1980, which was a huge milestone in the history of vaccination. Once eradicated, vaccination was ceased, and all the remaining stocks of the vaccine were transferred to US and Russia. No cases of smallpox were seen since then. Next, we go to a disease which is yet to be eradicated, malaria. This is one of the diseases that are in specific areas around the world, with 90% of the cases situated in the continent of Africa. As of 2017, there have been 216 million cases of malaria, with a mortality almost around 500,000. Majority of these mortalities are below the age of 5 years old. Current efforts to combat malaria are through funding for preventive mosquito nets, diagnostic tests, and therapeutic interventions, but these alone are not able to prevent the disease and shows the need for a vaccine to decrease the burden. One of the vaccines in the pipeline have just recently completed its phase 3 trial with results showing a potential public health benefit to combat the disease. Despite the benefits a vaccine provides to mankind and the historic event of eradicating smallpox, there are still numerous challenges that prevent current available vaccines from eradicating vaccine-preventable diseases. This is a non-exhaustive list of the challenges that vaccines face. First is affordability. The current efforts to mitigate this is with tailoring vaccine costs to the financial capacity of a country, which means costs are higher for higher income country and lower for low income country. Another is with the help of Gavi, which stands for Global Alliance for Vaccines and Immunizations, which subsidizes the cost of essential vaccines for countries with GNP below threshold and capacity building for developing countries to manufacture their own vaccines. An issue with affordability, though, is the changing needs between a developed country and a developing country. For example, most developed country with low incidence of TB has stopped giving BCG vaccines, which means that only markets available is the developing countries, which would lead to an increase in the prices for the future. The next challenge would be the logistics, for example, the maintenance of the cold chain or the distribution of vaccines to the health care facilities. This differs from country to country, and the efforts to better infrastructure and training human resources can aid in these challenges. But it also depends on the government's motivation and priorities. Socio-political instability also poses a challenge to vaccination. War and political instability changes the priorities of countries. One of the efforts, especially for war-torn countries, is the Days of Tranquility by UNICEF, which allows for a ceasefire between the warring countries to allow for vaccination of children on both sides. The issues here would be the growing mistrust to these kinds of efforts due to misuse of vaccination programs. For example, the CIA to locate Osama bin Laden. Another challenge is safety. Efforts to mitigate this challenge is the stringent clinical trial protocols that must undergo proper ethical board reviews and regulatory authority approval before the vaccine is issued to the public, and proper human resource training for the correct administration of the vaccines and its surveillance. The issues with safety will always be the target of anti-vaccine campaigns, not to mention clinical trials affected by socio-political agendas in certain countries, leading to public misconception regarding the purpose of clinical trials. Transitioning from safety, we go to the growing issues in credibility and mistrust leading to hesitancy. The efforts to tackle this challenge is through the active listening and understanding where it is coming from, which requires help of properly trained healthcare professionals. Sufficient markets is also a growing challenge for vaccinations. Efforts of Gavi to subsidize aids in this challenge, as well as global consortium funding initiatives to help in funding the researches for vaccines that does not have a global-wide market. The foreseeable issues here are similar with affordability regarding the changing vaccine needs between countries, and that some diseases still have a very specific subpopulation, which is not attractive for investments. Evolving pathogens are also an issue similar to that of antibiotic resistance, but can be decreased with the maintenance of proper vaccine coverage, which decreases the capacity of a pathogen to evolve due to lack of susceptible hosts. But the continuing hesitancy in vaccines keeps the goal of a high coverage difficult to achieve. Finally, surveillance is important to monitor for any possible unwanted outcomes from the vaccines. Efforts to improve and incentivize the healthcare providers that are the end users of these products to properly report and record unwanted vaccine events could help in mitigating this challenge, but the difficulty also lies with the patient's follow-up. This image is from the World Health Organization immunization challenges and shows the reasons that patients normally have for not following up. It can range from mistrust to scandalous health authorities, religious reasons of not vaccinations to a simple, oh, I forgot. It just shows the complexity of the challenges in vaccination. So let us wrap up this topic on the history and the burden of disease. The concept of immunization has started since the 1500s, and it has been an important tool in order to prevent diseases. Infectious diseases remain to be a significant cause for mortality worldwide and shows how important it is to improve on the preventive aspects such as public health and vaccinations. The eradication of smallpox is an important milestone because it shows that it is possible to eradicate a disease, and we could learn from the steps taken to achieve it. Control and hopefully eventual eradication of malaria, for example, can learn from the steps taken in smallpox. And finally, there will always be challenges to vaccination, but despite these challenges, there is continuous efforts to mitigate these to gain the protection that they provide. Thank you very much for your attention and see you in the next lesson.